Salutations, respected viewers. I am George from Ireland, and I'm not dead yet. So nice to infect you again. Anyway, coronavirus. We might as well laugh on our way to the grave if the species is doomed. I don't think we are. So this is with particular reference to the United States. So the United States got several thousand cases. It's just difficult to keep up. It's about 250 deaths so far, but obviously it's growing exponentially. This whole thing started in November in the People's Republic of China and was scarcely reported in the Oxford and didn't seem to be terribly serious. The Chinese government tried to suppress it. It's widely believed that Beijing lies about problems, doesn't face up to them. Until about 10 years ago, they would never report any disasters, earthquakes, things like that. The Great Leap Forward, where they starved millions of people to death, they won't acknowledge that to this day. Tiananmen Square, they just called it the 4th of June incident, won't release the true number of people they killed. 1 million Uyghurs locked up without trial and charge for their ethnicity, for their faith. And the Chinese government lied and lied and lied about these people being imprisoned for no crime. I've finally come clean about that. And then a Chinese doctor valiantly tried to raise the alarm, saying this coronavirus thing is deadly serious, it's going to spread rapidly. And he was locked up by the Chinese government. He subsequently fell victim to the disease himself. And the Chinese government has now publicly apologized to him posthumously, which is unprecedented for them. But anyway, it's spread out all over the world, and this is one of the downsides of a globalized world. People throwing this, you're a globalist. I'm not quite sure what that is. Well, I realize I share the planet with over 7 billion others, and they're of different ethnicities. They speak various languages and so forth. Does that make me a globalist? Someone who doesn't want to pull up the drawbridge and think that we can be hermetically sealed from other ethnic groups, other cultures, and so on. I come from a very multi-ethnic city, and to some extent multi-ethnic country. Republic of Ireland, not so multi. I think UK a bit more. But look at Italy. They got the second highest death toll in the world, over 4,000 deaths. Now, the Chinese said for 2 straight days they didn't have a single additional infection. I don't believe it. Is that remotely credible to have had over 80,000 infections and that they could completely stop it? I know there's a lockdown, certainly in some parts of China, Hubei province. One of my pupils in Beijing telling me she hasn't been out of the flat, that's apartment, for a fortnight, and that would drive you stir crazy. I know she's put on weight already because you just can't exercise. Press ups, sit ups, honestly, how much of that can you do at home? Comfort eating, getting depressed, people having blazing rows and being stuck together. Think I'm gonna murder my spouse if you're gonna be stuck in a 2-room flat with a person for weeks on end. Anyway, so Italy with 4,000 deaths, and China claims to have fewer than that. Iran's very serious as well. But the thing is, I do trust the Italian statistics. I've never heard it said that the Italian government lies about anything of this nature. A highly developed country with Italy, with a pretty good healthcare system, and even that's what they're suffering. So first the coronavirus cases in Europe were in February, very few, just bubbled along, and suddenly it exploded in March. Okay, the number of infections, of coronavirus infections in Italy has increased about 1,000-fold in March already, and we're only on the 21st of March. So look at the United States, about a month behind these European countries. So the United States, it might well be even for an awful lot worse. About 250 deaths, is that right? Several thousand infections. Sorry, is it 18,000? That's one figure I heard. I'm not quite sure what's true. Now, they can only diagnose someone if a person presents themselves, or indeed is somehow brought in. You have the equipment, you have sufficient doctors and nurses. Obviously, it's so expensive to do this in the United States. Would it be covered by insurance or not? I don't know. Say, well, I better not because I can't afford to, or if you can't pay, well, we're not going to do it. I'm not sure if that's going to kick in, which really emphasise the need for publicly funded healthcare. Now, one of my viewers here commented that it only spreads in single payer healthcare systems. Does it? Can you show examples of that? Is China a single healthcare system? I don't think so. Some countries it's spread quite a lot where it is, others not. Some of the Scandinavian countries manage to keep it very low, and they're single payer. Other countries, it's spread quite a lot, and they're not single payer systems. So it's got no cause and effect relationship. And the thing is, if it's publicly funded, you're probably more likely to seek help at an earlier stage. And any doctor will tell you prevention is better than cure, and failing that, early intervention. Like anything else, a stitch in time saves 9. If we get you early, we have a much better chance of saving you. If we get you later, we have a lower chance of saving your life. Even if we can, there might be worse long-term effects. But some people are completely recovered. So in Italy, it's still spreading, although I believe the rate of it spreading has gone down a bit because we've been locked down for a couple of weeks. Spain is taking it very seriously. People inside go to the pharmacy, go to buy food. That's it. The police patrolling the street. Likewise in Switzerland, not allowed out in groups of more than 5. You can go walking and go jogging, but like everything is shut apart from places you could purchase comestibles or medicines. There, if you break these rules, is 100 Swiss franc fine, which is not enough of a deterrent. That's not a huge amount of money. Anyway, so the United States may well be in for a dreadful situation. For some people, it's going to feel like Armageddon, or more and more, sorry, not really a battle, the apocalypse. Because what if it increased 1,000-fold in the United States? Yeah, we were on 18,000 cases, go up to 180,000 cases. That's tenfold, 1.8 million, 18 million cases. Even if only 5% of those died, that would still be 900,000 people. The mortality rate from this is anything between 1% and 8% in various countries. Some countries, the Scandinavian countries, Germany, have managed to keep the death toll very low, a very low percentage. Likewise, Republic of Ireland. Now, Russia got about 180 cases. They confirmed their last death, so their first death from this malady a couple of days ago. But again, is that huge scale state lying? Probably. And several Russian doctors, virologists, epidemiologists, have been quoted off the record saying the situation is far, far worse. The government's covering it up. It's mainly in Moscow. It's the Beth healthcare system. A relatively high per capita number of medical staff, but they're abysmally paid. Hospitals are under-equipped. A large minority of hospitals don't even have heating in a country as cold as Russia, where it could be minus 40. That could kill people in the winter. Probably the government is lying to try and stop people panicking, and because they don't want to wreck the economy even more. So the United States is probably in for a very rough situation indeed. And the Republicans appear to be unperturbed about this. About 80% of people 80% of Republicans approve of President Trump's handling of the situation, which is surprisingly low because usually his approval rating amongst Republicans is about 90% because he polarizes opinion so much. You would have thought a crisis like this might depolarize the situation, but no, it's not really. Although I say the Republicans are not as partisan on this as they used to be on most other things. A bit like 9/11, even people say, well, I reviled George W. Bush, but he's my president, and it's either him or Osama bin Laden. Of course, I have to give him my fulsome support. To do anything else would be an act of betrayal. So why are Republicans so unworried about this? Is it because they're so manly, they're courageous, they're not going to let something like coronavirus worry them? Well, you should be worried. It's going to kill people. Now, obviously, it is much more dangerous to certain demographics. It's very perilous if you're an elderly person, if you're immunocompromised, and if you've got some underlying respiratory condition. But Republican voters tend to be a bit older than Democrat voters and churchgoers. So people are still going to church. Congress shall make no law to abridge the freedom of religion. Did I quote that correctly? So could the government close churches if it wanted to in a state of emergency? They've never tried it before. So they can discourage people, but I don't think they can actually prevent people. These quarantines, I believe, are largely just urging people to do things or indeed to refrain from doing things, not compelling them. I know you can have emergency evacuation if a hurricane is coming, in certain states anyway. I don't know if the federal government can do it. But these people are usually anti-scientific. These Republican voters, much more likely to believe in evolution. Many of them are anti-vaxxers. Are you really going to refuse the vaccine if it's invented? Anyway, and not vaccinating their children and so on. So these elderly, anti-scientific, religious fundamentalists continue going to church and therefore much more likely to get it, sitting in a congregation of hundreds or even of thousands in a megachurch. And Fox News has been very keen to sort of shift the blame onto China, calling it Chinese coronavirus. Now, it's true, it originated there, but it's not like China's fault. They didn't want it to exist. They didn't create it. It killed more of them than anybody else until very recently, when the Italians overtook them. It's damaged their economy a lot. Why on earth would they want to do this? Okay, their government perhaps didn't publicize it enough, maybe didn't take firm enough steps in the beginning, but the USA is also guilty of this, and the Chinese at least had the excuse of perhaps not fully appreciating just how grave it was. because it broke out there first. Now, the gravity of it is very apparent to anyone with half a brain. The White House confirmed that President Trump has been receiving briefings on this for several weeks from experts. And then when he spoke about that, instead of saying something useful to the public, and he's got such a podium to address the populace, all he could do was harp on about one of his favourite themes, his cleverness, how he blew the minds of all the experts with his in-depth comprehension of all the particulars of this, and just how highly intelligent he is, and not giving them useful advice, certainly not at the beginning, and of course, most scandalous of all, saying it was a hoax, as if to totally disregard the thing. He's not saying that now, so it was yet another outrageous, sickening, deadly lie from Trump. And even if people are taking it seriously now, those who fell for what he said a month ago might be too late for them. If they've already infected, well, some of them have died. So, yes, it started there, but why people do you have to say that it's Chinese coronavirus? Now, oh my God, who's the little guy who likes to wear the dicky bow, the Fox News bloke, the xenophobe? I can't remember his name. The Swiss American, Tucker Carlson. Yes, it did originate there, but so what? They're saying linking it to Wuhan is not as bad because that's just a city, and there's not much anti-Wuhan prejudice. People like calling the common cold the white man's cold or something because obviously it's mostly whites brought it to the American continent, thereby killing millions of Native Americans. Not that was intention. Okay, sometimes they were deliberately killed, as in whites shot them, but it wasn't the intention to use coughs and sneezes to wipe out Native Americans. But that was the effect. You've got to ask yourself, how would you feel if it was your nationality, whatever disease started in your country, and then people were against you? I've seen Oriental people around London. I'm not against them. It's not their fault, even though they have or they don't. Now, some of them will be British Chinese people or British Koreans and so forth, British Singaporeans. Some of them are citizens. Some of them are citizens of other countries. They might be here on holiday as tourists, as students. Some of them will be trapped here, wanted to leave and then couldn't because flights to the Far East have stopped, or just chose not to leave because they're safer here. I don't begrudge them anything. Spite towards them would be asinine and rebarbative. But it's a bloke wheel the way that Fox News has tried to divert attention from Trump's failings on this issue by stoking xenophobia against our Oriental friends. It really is emetic. What else is I going to say about it? It's misdirection, one of their favourite tactics. But look on to the Democratic voters who mostly disapprove of Trump's handling of it, or who can disagree with them, but also taking this seriously, taking precautions. It's right to be reasonably circumspect. Obviously, the biggest single risk factor is age. Most of these people are quite elderly who've died. People in their 30s have died for it. I'm not sure about younger than that. The United Kingdom, there are roughly 2,000 cases. 2 of those are infants, neither of whom have died so far. Some people have recovered. So Trump, by his completely imbecilic comments, may well have killed off a lot of his supporters because the symptoms don't necessarily manifest for 2 weeks, and some people are asymptomatic for even longer, so I've heard. And the only way to contain it is if we could all be completely hermetically sealed and have no contact with anyone else. But that's impractical. Parents have got to care for their children, and we have to have some emergency service workers, doctors and nurses. We have to be able to go and buy food. We have to be able to go and buy fuel to get around. There has to be some sort of public transport, particularly in a country such as the United Kingdom, where a lot of people don't have cars. Some people don't live within walking distance or cycling distance of work. Some emergency services have got to be open so that these frontline public service workers can get there. In some cases, their children are still going to school, even though most schools are closed. They're open for the children of certain people, certain politicians, civil servants. They're considered essential workers, or indeed public service journalists, just so the public know what's going on. These transport workers too. So it's a considerable percentage of people who are going to continue to work and cannot work from home. I was hearing a nurse saying, well, I can't deliver a baby remotely. Midwifery can't be done that way. But it did cross my mind, could babies be delivered at home rather than in hospital? Because they say, so long as it's an uncomplicated pregnancy, midwifery can be practiced in a person's house. Because there'll just be fewer people around, less exposure. Anyway, the United States, I think, would have difficulty quarantining people because, oh no, we mustn't have the overweening power of the federal government or even of the state government. So that it'll be more difficult for them. I mean, the Chinese is an authoritarian state. People are used to obeying what the government says, or they get absolutely hammered. And it may well have limited their infections. It would be astonishing if it didn't. So turn the tide. Let's see how Singapore has isolated it so effectively and used a sort of detective approach to find who the hosts are, to separate them, and to get the death toll down. But if you've got superb publicly funded healthcare, you can probably limit this. Um, anyway, the population is quite diffuse in the United States, therefore more difficult to police quarantining. On the other hand, you're less at risk. The more remote you are, the safer you are. If you live just one person a mile away from anybody else and no interaction with them, then you're very, very safe. But I say so. A lot of Republican voters are going to die from this in the United States, but the Democrats tend to be more urbanized. So in that sense, they are more at risk. But I think they're quite aware that it's hazardous to socialize with other people. So a lot of federal government funding could try and sort this out, but we can't have that. We can't have the federal government paying for healthcare, except it does through Medicare and Medicaid, which of course Trump hugely cut back, despite promising to do the exact opposite. Um, so maybe people are going to see that the case for publicly funded healthcare is now a fortiori and ought to be introduced because it affects other people. And I've made this point in my videos for some time, and then a sort of textbook example has come along. So is quarantining people acceptable? It's a question of political philosophy. Now, I'm a semi-libertarian sort of person, so as a classical liberal, look back to John Stuart Mill and his harm principle that he propounded in the 1860s, saying that the government shouldn't prohibit things unless they harm others. You should be allowed to do what you want, insofar as it doesn't injure others. Now, going around and possibly spreading this disease is injurious to others, or indeed contracting it, because then you have to be carted off to hospital and cared by accident and emergency, which clogs them up, and then somebody comes in because of a heart attack or a car crash, might not get treated. But this person who had a heart attack, she may have brought it on herself through corpulence, a life of eating junk food or taking an insufficiency of exercise. So I realize there's an argument for saying she brought on herself, so she shouldn't be cared for either. How far do we go with this argument? It's imponderable. So although I am suspicious of governments preventing us from doing things, banning things, I think sometimes a little bit of it is warranted because it harms others. And there's a danger of coronavirus collapsing healthcare systems as it's doing in Italy, because there just isn't the capacity. They only have so many intensive care beds. They've only got so many doctors and nurses. You can't be two places at once. And the over 80s, if they've got coronavirus in Italy, they're just being left. They're just being left to die because doctors and nurses say, we cannot sandwich these people. We're going to have to care for a younger patient who's got a better chance of pulling through. They have to make these decisions. If you've got one ventilator but in several patients, who's going to get it? You're going to have to pick who's going to live, who's going to die. So these are heartbreaking decisions, but they've got to be made fast. You can't share it, otherwise they'll all die. Anyway, so interventions in the economy. Oh, we can't do that, say Republicans, except they've done it many times from Ronald Reagan onwards, and indeed some Republicans were for the New Deal under FDR. But they voted for bailing out Wall Street. John McCain, that Republican saint, was behind that, bailing out the automobile industry in about 2009, I know, supporting Obama's efforts largely, which was successful. And then a couple of years later, the automobile industry had been nursed back to health, was turning handsome profits, and was making massive profits until a couple of years ago. So there's talk of postponing elections, but I think that'd be very difficult to do because some of that's in the Constitution. There'd be various sectors of the US code would have to be changed, which mandate the schedule for elections in the United States. And Trump's presidency or first term is limited. It can't be extended. There's no precedent. No one's ever even tried to extend it. I know there was unlimited terms, but this is not seeking another term. This is elongating his current term. No, you can't do that. He ceases to be president on the 20th of January next year, and unless obviously his new term begins, unless he's re-elected. But postponing elections, the United States has never even attempted to do so, never even contemplated it. Wars have been fought, and the United States went ahead with elections on time and say, well, what are we fighting for anyway? It's partly our free society. The United Kingdom has delayed them in the First World War, delayed it in the Second World War, but each year voting delayed by 1 year. Could have held an election during a war, and indeed it did actually in the Second World War. July 1945, Germany had been defeated, Japan had not. Or even the First World War, okay, that December the 14th election, 1918, the armistice has been signed, but the Treaty of Versailles had not. So technically, the United Kingdom was still in a state of war. Australia indeed held referenda in the middle of the First World War, particularly on war issues like conscription. So there's absolutely no need to delay elections, which you can have online voting. You can have postal voting. We do that already a bit. Just make it complete. Now, people say this is prone to manipulation. Possibly it is. And Republicans might well start disseminating falsehoods, claiming that bogus votes were cast this way or valid votes were discounted and things like that, and trying to undermine the whole integrity of the election, trying to destroy public trust in public institutions, as Trump has been doing for some years, claiming that the FBI are like Nazis and saying absolutely nauseating things like that. Sporting events, I thought some of these could go ahead. The University boat race is due to happen Easter Sunday here in London. That's 29th of March. No, not Easter Sunday, I think it'd be Palm Sunday. And they could do that. There are only 9 people in each boat, 8 oarsmen and a cox. Obviously the girls' crew as well as boys' crew. And you could have minimal officials, no spectators. Ban the spectators, lock the park, Bishop's Park, cordon the area off, and it could go ahead. We're stuck in. It'd be nice to see some sport on telly, or indeed some sportsmen playing, even the Six Nations, but with no spectators. But the trouble is the cost of keeping the stadium open might make that terrible, a huge loss maker, because sports are losing out a lot because there are no ticket sales. And if they're not playing matches, they don't get any sponsorship either. They could at least get advertising revenue if they played the matches, test all the players and the referees and so forth. But is there the capacity to do so? Because the NHS is really full. I phoned my GP about something minor, and can I make an appointment for 2 weeks? No, she'll phone you. Because they're inundated with people. There's the worried well, people who've got serious symptoms and should go fine. Those who've got no symptoms, or I suppose just one minor one, because you sneezed once, and go to the doctor, and that's clogging up the system. So people who really need help are not getting there. But the idea is in the UK to test 25,000 people a week. Isn't that right? Or no, it's a day, and that'd be good to isolate, to treat those who need to be treated, and so forth. The mercy is that children are hardly at risk. Babies are a little bit, but children who are several years old or into their teens are relatively safe. But that doesn't mean that they should not take any measures whatsoever to minimise their exposure. But the Olympics could go ahead. That's only going to miss out in August. We might have the situation really under control by then. Japan is an island, helps, and there are very few foreigners living there. And not that foreigners are particularly more likely to have got it. Japanese people could go abroad, get it, and bring it back. It's already in Japan a bit, but test all the athletes. Japanese athletes, test them before they got onto the plane, test them after they arrive, and so on. Likewise, all the officials and the spectators, or only have Japanese spectators. Indeed, we could still have the Olympics. So I remember the United States as a sort of pre-screening to fly to the United States as a counter-terrorism thing, might well be a counter-coronavirus thing. But because the Trump administration didn't take it seriously, they really dealt with this in a ham-handed manner and exacerbated it. It could have been contained. Now, you could say the same about the United Kingdom. Perhaps Bojo was tardy. Was he timely, or was he even premature in doing what he's doing, bounced into it by public opinion? I think about right. I'm willing to believe that I'm mistaken, that perhaps taking firm action sooner would have contained this. But the idea was not to have the lockdown too soon. It's not really even a full lockdown, because people would start breaking it, just be unenforceable. And apparently in some countries people are already breaking it, just can't take it, especially as the good weather gets in. As for the UK, they said about GCSEs and A-levels, these exams, that they'll be cancelled. Well, they said at least certainly not begin sitting them in April, May, and June. Could have pushed them back to July and August. But the trouble is, if we could just award people their grades on the basis of how they're doing in schoolwork and coursework. But there'll be pressure. Say, I want grade 9. Well, we're going to give you grade 8 on the basis of this. But complaints, and they'll be directly at the school. And so schools are always tempted at going for grade inflation. We've got to say, if only 10% of your pupils got a grade 9 in geography last year, only 10% of them can get it this year. It tends to go up a little bit every year. And the pupils might start whining about it, but say to them, hey, just count yourself lucky that you got the exam without actually having to sit the exam. You got the qualification. And the trouble is, if we say that these exams shall not be taking place at all, then people will say, well, I'm going out to party. The adolescents will say, let's socialise, let's play sport, especially when the weather warms up. So we've got to keep them off the streets, and the devil makes work for idle hands, teaching people online. But I wonder if this has been the new normal in certain sectors, working from home, because we'll see how doable it is. And the air was better, and we didn't have to spend money on transport. and we didn't have to waste money, waste time commuting. Great. And when we get the all clear, some people won't trust it. I'm a bit more cautious. I'm not going back yet to work. I'm not going to the restaurant. I'm not going to the theatre. So it may well be very bad for tourism. But on the other hand, you can read all these books, you can watch all these films, you can stay at home, do DIY, do gardening, which you never could before, and you've saved loads of money. So you can really treat yourself when things reopen. Well, I'm going to go to some really good, expensive shows and visit some places. When we're out of this, Bojo says we can beat it in 12 weeks. This lockdown could it even last 2 weeks? Probably very likely. And how much self-discipline do we have? That's the fascinating question. So the United States, I think they're going to suffer tens of thousands of deaths, could be hundreds of thousands of deaths. In the UK, roughly only 200 deaths thus far. Is it increasing? Is it going to spike? Is it increasing exponentially? Probably. We might have seen nothing yet. But this could soon be the new normal. We just become desensitized to it. That's the fascinating thing. Because we've had such good healthcare for so long, death happens to other people out of sight. They go to hospital, they go to nursing homes. It doesn't happen amongst relatively young, healthy people. You know, you go back a century ago, and almost every family had someone who died in childhood. And it was out in the open in public. We were accustomed to it. It wasn't hidden away. We had to face up to mortality. So it was a very sobering reminder of my own mortality. And I'll say again, don't worry too much about money. The other thing is healthy eating. Well, you know, healthy eating be damned. I'm going to have that unhealthy thing, that tasty thing, because memento mori. Hearing all these death statistics, we're not immortal. We can never be immortal. So enjoy it now. Savor the flavor, and don't trust on seeing tomorrow. Well, these are my uncollected thoughts. So please subscribe to me. Make sure that you're donating on PayPal or Patreon. PayPal is georgecallahan79@gmail.com. Choose me for online lessons in English as a foreign language, English literature, history, geography, religious studies, politics, French, and law. And I can help you with your essay, thesis, dissertation, and so forth. And I can be your tour guide in London when tourism reopens in about 10 years' time. Toodle pip.